us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
My guys, I want to discuss some 7 things where people they talk about Corona plus you.
You put the worry. You don't say Corona really kill black people.
Make you no make anybody lie you. Corona no dislike give anybody crap. True say it start for China, but right here, it catch everywhere where they feel kill anybody, especially people where they get some other sickness. For places like Yankee, Corona they kill black people pass. Yeah, Charlie, some people say they talk say China people wouldn't share do them, or it be 5G safe where they cause them. But shine your eye, it no be anybody do them. We 5G to no go fit cause the sickness. The 5G safe, it dey like the 4G where we all they take browse righty, it just be upgrade. People too they talk say if you get Corona we chop plain, take garlic, onion, ginger and lime, the sickness go. But this one too be lie. This thing's good for the body mom, but I don't know if it prevent or cure Corona.
So what about Sobolo?
Me self, I dey like Sobolo, but into no they do Corona nothing.
Appeal to
Corona mainly they attack the lungs, so appeal no go fit do am nothing. The truth be say, people wey dem dey booze, Corona they feel worry them, papa. People too they talk say if you cut onions put your room, Corona no go come there. But Corona no they like mosquito, where go fit kill am plus coil.
Then how we go feel protect on our body?
Corona they spread where more people self get, where they no know. So Charlie, if you no get anywhere important go, make you dey house. But if you really for come out, then you for wear mask, then stay at least 2 meters away from other people. If they wash your hands, then use hand sanitizer more times. But I beg, make you no drink them. If you dey call for sneeze too, do for your elbow inside. Take some bleach to clean surfaces where they touch. But this no be for your body. Finally, if you feel say you get Corona, may go chop for one corner, so say no go spread them. If you get plenty rest, then drink more fluids. But if they make worse, then for call the emergency numbers. Charlie, this be all for today. But if I hear any other thing, I will come back to talk about them. For now, if we make sure say we go protect we, our family, our friends, then everybody from Corona. We all for play one part, so say we no go increase the pressure where it dey on a healthcare system and on a healthcare professionals them at all.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa. Hello everyone, good morning, good afternoon, and good evening wherever you are in the world. Welcome to the health segment on Trend Africa TV. I am your host, Empress Mousy. As we all know, the COVID-19 pandemic has come into our lives and it's changed things for the worse. However, it doesn't have to be a bad thing. We can live with it. That is why the GNC, in collaboration with Trend Africa TV, we are bringing you updates on COVID-19, the way forward, the way we can live with it. So far, we've asked so many questions and people are continuing to ask a lot of questions. Today, we are going to be tackling the pediatric population. But before we go on, I would like to urge everyone, plead with everyone, please share the feed. Subscribe to our YouTube channel. Follow us on Instagram, Facebook, like our pages so that you can always get the notification when we come on live. However, if you weren't able to catch us live, you can always catch us live on YouTube as long as you subscribe to our YouTube channel and you hit the notification button. Ladies and gentlemen, kids, wherever you are in the world, we are going to take a second right now and we'll be right back. I will give you the opportunity to go ahead and share. Invite your friends, your enemies, and family. We'll be right back.
Pause a minute for today. Wash your hands clean and pray. Global epidemic day. Corona. People dying every day. Corona. It be virus. Mania. Funny serious. Corona. Yeah, virus. Echewa. You go lost.
Purchase your track now.
Wash your hand daily with running water and don't stop. Keep away from non-family things and do something, bro. Pray for your enemy, pray for your family, pray for your country, yeah. Don't forget to keep clean with hand sanitizer. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona. People dying every day. Corona. It be virus. Mania. Funny serious. Corona. Yeah, virus. Echewa. We go lost. China, Japan, man down. Italy, UK, man down. United States locked down. What now? Pause a minute for today. Wash your hands clean and pray. Global epidemic day. Corona. People dying every day. Corona. It be virus. Mania. Funny serious. Corona. Yeah, virus. Echewa. We go lost. Pause a minute for today. Wash your hands clean and pray. Global epidemic day. Corona. People dying every day. Corona. It be virus. Mania. Funny serious. Corona. Yeah, virus. Echewa. We go lost.
Hello, everyone, and welcome again to the Trend Africa TV health segment. Actually, it is the health segment on Trend Africa TV. Thank you, viewers, for joining us. I am Empress Mausi. And as you all know, we have our regular professional panels that will be joining us today. No other than Miss Eunice Cromwell. And though I've introduced her so many times, I am going to go ahead and introduce her again because some people are joining us for the first time, and she's just awesome like that for me to always reintroduce. So the beautiful Mrs. Eunice Cromwell is a family nurse practitioner who provides continuing comprehensive healthcare to all ages and genders while emphasizing on disease prevention. She is also the financial manager for the Ghana National Council. Mrs. Eunice Cromwell, thanks for joining us today on Trend Africa TV. Always
Thank you. Love you too. Good evening to all.
Good evening. So our second on the panel is Dr. Ofori, though he is not here right now. As soon as Dr. Ofori joins, we'll be introducing him. So I'm going to go ahead and introduce our guest star for today. She's none other than the beautiful Mrs. Dr. Sybil Pencil. Am I right?
Yes, thank you so much.
Look at that smile, people. Do I see dimples? Lord have mercy. Lord have mercy. Okay. So I'm going to introduce Dr. Sybil. She is a multi-talented woman who wears many hats in her efforts to impact the society. She is a physician, pastor, educator, musician, a best-selling author, and many more. We could go on and on and on and on. She graduated from the world-renowned Johns Hopkins Hospital School of Medicine and went on to train as a pediatrician. Viewers, I can go on, and if you need more information about Dr. Sybil, just contact Trend Africa TV. Dr. Sybil, welcome again to the show, and congratulations on gaining yourself a new stalker, which would be me.
Oh, that's wonderful. And thank you for having me on the show. I welcome your stalking.
Thank you so much. Okay, without much ado, listeners, I would like to give the platform to our beautiful Mrs. Eunice Cromwell to give us some updates on COVID-19 and where it's heading to right now.
Thank you very much. So, right now, we've talked a lot. Every other Thursday, we've gone through a lot of the symptoms. And so, all those things are pretty much the same. Only thing I'd like to add is that recently they've noticed that it's been a lot of neurological symptoms. So, there's been more seizures attached to it, more headaches. So, I still want to just encourage everyone to really understand their body. So, if you're someone who has seasonal allergies, and this is a time for flu and allergies and everything. And let's say you're starting to get headaches. If that is something new, you do need to talk to your primary care physician so that we'll be able to monitor it. Remember that the incubation period for COVID-19 is 2 to 14 days. So if you are having symptoms and they're not severe symptoms, you need to stay at home and quarantine yourself, meaning that you just need to stay away from everybody, very good hand washing, and making sure that you're using hand sanitizer. Now, the only reason why you would need to go to the emergency room or seek emergency services is if you're having severe shortness of breath. Now, I'm saying severe because there are people who already have asthma, COPD, so naturally they have a baseline of a little bit of congestion. They might smoke, so they already have like a smoker's cough. So that's not what I'm talking about. I'm talking about something that is affecting your airway, something that is new. You would need to, talk to your primary care provider, or if it's very severe, you would need to initiate emergency services and call 911. Remember that there are a lot of testing sites. They're drive-through testing. So you can just drive up, especially Swedish Covenant Hospital, which is on California, California and Foster. You can just drive up there and they'll be able to swab you, and then you'll get your results back. So let us just remember to really, really do very good hand washing. Make sure you're wearing your mask. When you're wearing your mask, also make sure that you're just not putting it anywhere and putting it back on. When you're in the car, there's no need to wear a mask. When you're at the grocery store, there's no need to wear gloves. You need to just do very good hand washing, because if you have on gloves, everything that you touch, whatever bacteria that's on those gloves, you are also transmitting that all over the place. So I want to discourage everyone today from wearing gloves unnecessarily. Unless you are in some type of patient care or anything, that's the only reason why you should be wearing gloves. In terms of the mask, make sure that when you take off your mask, if it's a reusable one, you're putting it in a container, a breathable container. You're sterilizing it. For those of us who have the different cloth ones, make sure you're washing it with mild soap and hanging it to dry. You don't need to put it in your dryer. I'd also like to discourage you from washing it in your washing machine, because things in the washing machine, unless you are going to wash your whole washing machine, you are also putting bacteria in for other clothes that you want to wash. So this is something that you can mildly wash with some Dove soap and hang it up to dry. Make sure when you're using the disposable mask, you are also throwing it away if it were to get soiled or damaged. Don't just keep a mask on all day. If you're wearing a gown and you're doing patient care, make sure that you are throwing it away. And for those people who I've seen walking around the streets with shield on their eyes, again, those type of material are meant for the hospital. So it is okay for you to be outside just with your mask, good hand washing, and hand sanitizer. That's all I have for today.
Yes, yes, yes. Thank you, the beautiful Mrs. Cromwell. I know you'll be hanging around so that we co-interview the beautiful Dr. Sybil. Dr. Sybil, are you there?
Yes, I'm right here.
Dr. Sybil, I know I have already pre-introduced you already, but please, can you tell us who you are and what is it you do?
Absolutely. So thank you again for having me on the show. I am a pediatrician in Baltimore, Maryland. My primary job, though, is as a program director, meaning I train pediatricians here in Maryland, and that's the key part of what I do. I also serve as a pastor in a church, and so I'm heavily involved in a lot of community activities in addition to the work that I do at the hospital front. So that's just a little bit about what I do. You talked about the authorship. I've been honored to write a couple of books. My last book, which is The O Factor, is the one that was the bestseller, and it's still available and out there. So just a few things about me. I'm really honored to be here tonight.
So, Dr. Sybil, where can we purchase your book, or can we download it too?
The O Factor is available on Amazon. So if you look up The O Factor, you'll catch it right there.
Okay. Okay, so without much ado, I would like us to roll into pediatric questions. I'll give the first honor to Mrs. Eunice Cromwell.
Great. Thank you so much, Malisi. So I think our first question is, Dr. Sybil, we noticed that when this thing first came out, they spoke a lot about it being a disease that was attacking certain population. There really wasn't that much research about children, but now we've also heard that a lot of children have had symptoms of COVID-19, and unfortunately, some have even passed away. So how is it evolving to be a disease that is also attacking children as well?
Yes, you said a lot of really wonderful things about this virus. And I think the key thing is it's a brand new virus. And so a lot of the information that we initially had were all deductions from what we've seen with other viruses. And we soon found out that this virus has a life of its own. So most other viruses tend to affect children and the elderly. So initially there was that fear that, oh, we need to watch out for children. And that was one of the first curveballs, right? That this particular virus affects the elderly. It affects older adults, but it wasn't quite affecting children the same way. And then somewhere in April, we got that report out of the UK that really started to shed light about serious infection in children, and that's the multi-system inflammatory syndrome in children. And then we began to see more and more cases of that here in the United States as we saw more COVID cases in general. So when it comes to children and COVID, it's still evolving. We're still learning about it. We're still understanding the epidemiology of it. But we do know that there are certain subpopulations that are still at very high risk. There's one study out of China that, yes, confirmed that there are a lot of children who are asymptomatic or have mild disease. Now, just as a sidebar, we have to really be careful when we're looking at data and trying to figure out what it means. So this particular study saw that only 4% of children were symptomatic, but you always have to think about who is the group, right? So this is amongst children who were tested. So if you're looking at children who were tested in that particular study, only about 4% were asymptomatic, but about 51% had just mild disease. If you were to extend that to a whole population, we might find that many more were asymptomatic altogether, okay? So there are a lot of different things that we're learning about children. We're learning a lot about multi-system inflammatory syndrome and how to treat these conditions. The good thing is the mortality rate is lower as well, so that's a good thing, but it doesn't mean that we need to be careless. No, children can also be vectors, meaning even though they're asymptomatic, they can pass it along to someone else. So we still need to watch that population very closely. Two other high-risk groups I wanted to talk about: children with sickle cell and children under the age of 1 are still very high risk when they get COVID to become very sick from it. So we need to be aware of that, particularly in West Africa and amongst Africans and African Americans, where there's a higher degree or prevalence of sickle cell. We need to be aware of these different risks.
You know, when a couple weeks ago we had an OBGYN on our program, and she said that the pregnancy rate had actually increased since COVID-19. You know, everyone's at home and having a good time. So I wonder, when children are born right now in this time frame, are there other clinical pathways that you follow? Are we giving them additional vaccines upon birth? Are we taking any other type of precautions because of the COVID-19?
Good question. Every protocol and the American Academy of Pediatrics have issued really good guidelines for the care of both the mother and the baby in this whole setting. So there's pretty much universal testing in most centers of the mother and protocols in place for the care of a child if mother is positive, and also if mother is negative but symptomatic. So there are a lot of protocols and guidelines that hospitals are following to make sure that the children are well cared for.
And is it a hard time right now teaching the pediatricians? I know it's a nervous time because everyone's learning about a new disease. It's not in the textbooks yet. So how are your students feeling about learning something that no one knows about every day?
Yes, I'm really fortunate to keep an amazing group of residents who really are eager. But frankly, because pediatrics as a whole has not been hit as hard, we really cannot complain. Our colleagues in adult medicine and surgery, anesthesia, have been really overwhelmed with COVID cases. So in pediatrics, I think it's been the opposite. And when we talk about the impact of this pandemic, I might talk about that as well in terms of teaching and education and the impact that this is having.
Absolutely. Mausi, I'll turn it over to you.
Thank you, thank you, thank you.
You're welcome.
Mrs. Dr. Sibo, I'm sorry. I
That's
wanted to
fine.
find out. Those children or those parents that decide or have decided not to vaccinate their children, are their children susceptible? So I can never get that word.
That's okay. So we currently do not yet have a vaccine for COVID-19. Okay. So we'll see once the vaccine comes out. There are a couple of companies that are working on it, and preliminary data looks good. But like I said, we have to study these things, and we can't just make predictions based on past vaccines. We have to see the efficacy of this particular vaccine and see how things play out. But the thing that's interesting is there is a good portion of families who don't believe in vaccines at all, not just about COVID. So it's going to be interesting to see how this plays out. Now, the good thing is we are hoping for what we call herd immunity, meaning to have enough people in the population who are vaccinated that it decreases the risk of spread to others. So we don't need 100%, but we need a good amount of people vaccinated to have this herd immunity. So once we have the vaccine, then we're going to see. But I can only anticipate that those who are against vaccines, or anti-vaxxers as we call them, are not going to want this vaccine. I can see that coming. I can see it coming. I can see it coming. And we just have to be prepared for that. But again, hope that we have enough of the population. I think we need to learn from this virus. This is what the world looked like before vaccines were available. And so really, I'm a pediatrician, I'm biased. I believe in vaccines. I believe in vaccinations and what it adds to our society. I do not believe it's just a big government ploy to inject us all with something. No, it saves us from sickness and disease. So I'm really curious to see the vaccination rates. Now, I will tell you now that this pandemic has actually influenced negatively the vaccination rates across the United States. So when you compare vaccination rates in April of 2020 compared to vaccination rates of last year, it has gone down significantly. So that's one major impact. When you look at the data, I think there's been like a 56% decrease overall in all childhood vaccinations. Okay. So this thing has had a great impact beyond just the disease itself. And when we
is it the fear? Are people just afraid to continue vaccinating?
People are afraid to go to the hospital. People are afraid to go to their doctor's offices. And so they're not going in for their regular checkups. They're not getting vaccinated. So this is one of those areas where there's been a definite impact. That's not necessarily the infection. So the infection for COVID may be low, but it's in children, but it's having other effects on children.
Thank you, Dr. Sable. So during this pandemic, I know one of the better ways to know the status or to find out if a child has hit their milestone in growth is by making a very good physical assessment. At this moment, are you physically assessing your patients, or you are going by video visits? And with video visits, how is that? How is that? I mean, how is that
Very
working?
difficult. It's a good question.
It's difficult, but it's also good. So let's talk about that. So there's that perception that if it's a telehealth visit, then it's not as good. Now, if you have certain symptoms, the first thing you're going to do is call your pediatrician. And based on what the complaint is, they may advise you to actually come in. So for example, if someone is having abdominal pain, I need to feel their stomach, right? I need to do something beyond looking at them. But when you're talking about development, getting back to your specific question, you can learn so much from a telehealth visit watching a child in their natural habitat, so to speak, as opposed to sitting on a mother's lap or a father's lap in a doctor's office and restricted. So our colleagues who are developmental specialists are actually talking about how amazing and valuable where they can just talk to a parent, have it on video, and just let the child play in the background. And you can see so much about what they can do. Can they pick up a block? That's fine motor skills. You can see that. Are they running around the room? That's gross motor skills. When you
Right.
say, hi, Johnny, do they stop and turn around and wave back at you? So you can actually do a whole lot in a telehealth visit and get a lot of meaningful information. But if you need to listen to the lungs or listen to the heart, etc., we will bring you into the office. So we're doing a little bit of both, and it's really valuable. Still, just call your pediatrician. They'll guide you. They'll tell you what to do. And if you're really concerned, please go in. Unfortunately, I've had to seek healthcare during this whole COVID pandemic, and I have been amazed about the care that facilities are taking to clean areas before you come in, after you leave, to make it as safe as possible. And of course, we also need to do our due diligence with hand hygiene and making sure that we're doing everything to keep ourselves safe. So yes, we're doing a little bit of both to make sure that our young patients are well taken care of.
Thank you, Dr. Sabo. One thing I have noticed in the Ghanaian household is, this is not COVID related, but one thing I've noticed in the Ghanaian household is, as a mother, I'm even guilty for that. Before I went into healthcare, I would take my baby to the pediatrician, thinking, oh my God, they need to give him some antibiotics. I've already diagnosed what and know the medications that need to be given to this baby. Then I get there and she's like, oh, don't worry, just give him Tylenol. I'm like, what? I found myself changing pediatricians like 3-4 times because I thought that pediatrician didn't know what they were talking about. Or maybe if there was a leftover of some antibiotic at home, I would just go ahead and be like, you know what, shove it down his throat. And I'm like, okay, I'm a good mother. I'm taking care of mine. But this is very wrong.
It is very wrong.
That most of these symptoms are viral. So when it's a viral infection, we don't need antibiotics.
Correct, Dr. Mom. You're right on the money. You are right on the money.
Can you please let the Ghanaian household know that not every runny nose or cough needs antibiotics?
I think the important thing to say is antibiotic resistance is real. Antibiotic resistance is real. Antibiotic resistance is real. If we're learning anything from this pandemic, we need to learn that these little bugs, so to speak, they are powerful organisms. Viruses and bacteria are smart organisms. And what these bacteria do is, after we expose our children and animals to so many antibiotics, then the bacteria begin to build resistance to the antibiotics. And then eventually those antibiotics do not work. And when you're dealing with a bacteria that is resistant to all these antibiotics, it's just like what's happening right now with COVID-19, where we have a virus that's going amok and we can't stop it. That's what it looks like when you have bacteria that are resistant to the antibiotics, and they can just do whatever. So the way to prevent that is we all need to be very, very vigilant. All of us as physicians and all of us as parents. Okay? When we go in demanding antibiotics, and we've gotten so good at it, and we know where to go to get what we want. But I'm going to look right at you and say you're not being a good parent when you do that. I said it. You're not being a good parent. We do that to fill our own need to do something. But let me say, just because we're doing something doesn't mean we're doing something good. Hello, Mama. Hello, Daddy. There's some things that the best thing you can do is do nothing. And that's what it looks like to be a good parent. Remember when we were told that when your 2-year-old is having a tantrum, do nothing? Yes. Any attention? And my son got so smart. I would leave the room, make sure he would safe and leave the room, and he'd pick up his stuff and come marching after me, come to wherever I was, and throw himself on the floor and throw the tantrum. And I'd and go to another room, and he'd look around and he'd pick his stuff up and follow me. There's some things that are best handled by doing nothing. If your child has a virus, do not force someone to give you antibiotics. And here's another thing. If someone cannot give you a definitive diagnosis, don't accept antibiotics. Okay, so someone says the ear looks just a little bit red here. No, don't take it. If we don't know what we're treating and we start you on antibiotics, then when you get worse, we don't really know what to do. And then we just start playing with all kinds of antibiotics, trying to do something, because at that point, if we do a blood culture, it's going to be negative. Okay, we've kind of partially treated the situation, and it gets much messier. So two things. Number one, don't force us to give you antibiotics, but also if you're dealing with a physician who's saying, or a practitioner who's saying, maybe, don't take it either. Wait and let it play out. If your child is getting worse, take them back, okay? And we'll figure it out. So you got on my pet peeve there, man. Antibiotics, that's my thing. So I had to go a little deeper with that.
I'm so guilty. I mean, I know better now, but I feel so bad when I look back at the things I did to my sons. I'm like, oh my goodness. But anyway, thank God we have people like you who are willing to give us free information. Thank you so much. God bless you.
Yes.
Okay, viewers, we are going to take a little break. Let's go drink some water and pat our nose. And I have to make sure my eyelashes are still on there. So we'll be right back. Don't go anywhere.
Charlie, this corona thing slow everything down, eh? When all this go end, make a call Dr. Amina, she say she get some information.
Hey, hello, Adam. I hear from you, Chao. How be you and your family?
We all be cool, oh. I hope say you be fine too. I call ask some questions about coronavirus.
Sure. What things you want know?
I hear say corona medicine they wait them to hide them.
Me self I hear, but it no be true. Plenty research they go on to find corona medicine, but this usually they take time. Researchers too they try some of the old medicines, and some they show good promise. We for hope say the hard work will pay off soon.
So what about medicines where people they call immune boosters? Then they fit prevent or cure corona? How about if I take plenty vitamin C and D?
As with all infections, your immune system they help fight corona. You go fit take some food supplements support your immune system. But if you dey chop balanced diet, you dey get enough nutrients. No research they so say taking plenty supplements will protect you from corona. The medicines them they call immune boosters too. Nothing they show say them go protect you.
And what about vaccines?
Yeah, vaccines they help, but that usually be to protect people them no yet get the disease. Plenty research they go on to find corona vaccine, but this usually they take time. People self-start talk say vaccines no good, but that no be true. It be sake of vaccines where some diseases like polio no they worry we again. You know what? The vaccine matter there. I go take my time explain them later.
Oh, okay. So how we go protect one body from corona?
The best way be say you for day house as much as possible. But if you for come out, you for wear mask then day at least 2 meters from other people. You for make sure say the mask they cover your mouth, then nose all. You also for wash then sanitize your hands more times, then make you no touch your face. Take some bleach to sanitize your surfaces. If you feel say you get corona, you for quarantine yourself. You for rest plenty, chop well, then drink plenty fluids. But if you know they make better, then you for call the emergency numbers. If you get corona, it no they mean say you go die. More people they recover cry. Yeah. We all for follow these simple directions. So say we go protect we and other people from corona. And we no go overburden one of healthcare professionals than healthcare system.
Hey, Dr. Amina, that you shack rough.
Hey Adam, Sean that thing. Which madam then the kiddies give me.
Hello everyone and welcome again to the show. I am Empress Mawusi here on the health segment of Trend Africa TV. Yes, today we are talking about COVID and how it affects the PIDS population. Before we go on, Dr. Sibo, what ages fall under the pediatric range?
Yes, I take care of children up to age 21.
Oh, really?
Yes.
It's hard for me to think 21 would be a PIDS patient. I don't know.
Yeah.
Okay.
Well, they start transitioning to adult providers usually around that time, but we are credentialed to care for children up to 21.
21. Okay.
Yeah.
Thank you. So in these times of COVID-19, let's talk about childbirth. Would it be advisable for the mother, for the fear of contracting COVID, would it be advisable for the mother to arrange a home birth, or it's also safe for the mother to go to the hospital?
That's a good question. I can't say much about home birth specifically and safety, but I can say, at least based on what I'm seeing in my hospital, the measures to create a safe environment it's just phenomenal. For example, we already have environmental specialists who do cleaning. Now that's jacked up to a whole different level to create a safe environment for our patients. And that's going across in hospitals across the United States. I don't think that if you have planned for a hospital visit that you should switch for home birth just out of fear of coronavirus. No, I think you need to go ahead with what you have planned for, speak to your physician, ask them about safety measures, ask them about practices at the hospital where you're planning to deliver so that you can get all the information that you need so that you feel safe. So that's how I would think about that. I wouldn't make a switch just because you're afraid. No, get the information, understand what's going on where you're planning to deliver your baby, and make sure everything's intact so that you and your family are safe.
Thank you. Dr. Sable, how chaotic? I know school is going to be reopening in during the fall season. I want to find out, how chaotic do you think reopening school would be, especially the preschool population?
Yes, that's a very good point. Remember, I alluded to this whole issue of the impact of COVID-19, and education is another area that has really, really, really been impacted, and the children are being impacted. So studies show that in general, just over a vacation, over the summer break, there's a bit of decline in skill that children go through just by taking a summer break. But now we're talking about a break that's been much longer because of COVID-19. And even if it wasn't a break, we're talking about situations where some children had to be taught by their mothers and fathers.
Yes.
And we were terrible teachers.
It was bad.
We were really awful. Bad. We were awful. And so there's a lot of decline. So many of the children are starting out, they're going to start out the next school year in a lower level or lower sphere for reading and math both. Okay. Wow. And so schools have to be very, very strategic. So when I think about the chaos, I'm going to start really talking more about the school age children. For school age children, you really need to look in your state, because states are putting out guidance for schools. And then schools, particularly if they're public schools, they're just going to have to follow the state guideline. Private schools might have guidance, but then each school might develop systems. So as parents, you need to look into that. Don't just sit back and assume the state's going to do what's best for my child and I'll just do whatever. No, you need to look into the guidelines. If you're part of a private school system, you need to ask them what systems they're putting in place. Okay. If your child is a special needs child and is on an IEP, then their needs are even greater, and you need to understand how the school system is going to accommodate them. Okay. And then there's some of you who have really smart children who really don't need to go to school. They can stay at home and they function very well at home because they're very good independent learners. And so you may need to think about a balanced approach to what your child needs. And that's my big message for parents. You need to be a strong advocate for your child. One child may be different from the other. You may have one child who really doesn't need to be in school 5 days a week and can get it done from home. You might have another child who needs a little bit more guidance, and maybe they do need to be there 2 or 3 times a week. So you need to figure that out and understand the system, understand what the school is doing, and advocate for your child to get the care that they need. Now, for preschool children, it's going to be more about safety, just pure safety, pure, hygiene and cleaning. What's the ratio? How many people are going to be available to watch the child if you're going to put them in a preschool setting? And it's really important that you pay attention to these, to what their systems are going to be. And for some of us, we may need to make other arrangements and working within family. And if you're working from home or someone else is working from home, really trying to find a balanced approach. It really does take a village, and we need to figure out how to make it work. Some preschool settings, they won't be able to accommodate as many children as they used to. So your child might not even be on their list anymore. So you might have to make other arrangements. So this is the time now. Don't wait till September. I know we're all tired. I breathed such a sigh of relief when the child was done with school. I'm like, thank you. I just, but time is not on our side. So this is the time to start asking those questions, start looking into the guidelines. You need to know the guidelines yourself so that if the school or the preschool isn't following the guidelines, you can be the one to say, hello, question, why aren't you doing ABC? Okay, if there's anything I've learned, particularly about the United States, you have to be the advocate. Don't just assume that it's going to be what's right for my child. No, be an advocate for your child.
Thank you. Dr. Sable, our children are being exposed to a lot of harsh chemicals in these terms of COVID-19. We are cleaning our surfaces a lot more now with some of us are going really all out. And then they're going to be going to school and then they're going to be exposed to more harsh chemicals or probably in school too. How can, is this not going to have a negative effect on the children eventually?
It can. And so we really need to be cognizant of that. And also, even in our homes, we really should not be using harsh chemicals and going wild and crazy. Okay. Cleaning your surfaces at the end of each day or the beginning of each day, once in the day is fine. But we really need to pay attention to is the hand hygiene. Okay. We don't need to go so crazy. Yes, we need to clean the surfaces, but the more important thing is the ongoing, consistent, and frequent hand hygiene. And I think that's one of the good things that's going to come out of this is these are things we should have been doing anyway, right? Mm-hmm. And so really teaching children how to really pay attention to that and wash their hands. We emptied the shelves of all the sanitizers in the world
I know.
in March, and we forgot good old soap and water, good old soap and water, good old soap and water.
Mrs. Eunice, do you have any questions for her, please?
Sorry, I was on mute. No, I'm really, really enjoying. I think that a lot of people are very concerned, especially when you have younger children, and you just want to make sure that you're doing the right thing for your children. Yes. So in terms of going back to school, I know you talked about safety. How effective do you think, or how effective will the school be in making sure that your child keeps a mask on all day? I used to be a school nurse, and I know that the kids are so nasty. They don't. You're taking them to the bathroom.
Kids are nasty. I like that.
It's so hard to even get them to wash their hands after. I remember they used to line them up for like potty time, and I'm just thinking, like, with all this, plus the, they already come to school with colds, right? Because a lot of parents have to work, so they still bring their kids to school sick. And so with all this, with COVID-19, with the mask and everything, I just don't see, for the elementary student, I should say, how possible, or I don't know how it's going to really be for the teachers. I really feel for them.
I agree with you. I feel for them too, because it's going to be impossible. Mm-hmm. Listen, look at yourself at home and think about how amazing we are being as parents, keeping our children safe. We're not doing the best job. It's impossible. And then extrapolate that to a school setting. So you're right. There are major concerns. Now, a couple of things, though, that you can use as clues. You want to look at the last few weeks of school for your child and look at how the school responded. Look at what they did. Look at how ready they were or weren't, because that's going to be your best predictor for how good they're going to be in the coming season. It's going to be a good predictor for what they're doing now or not doing to get ready for the season ahead. I was really impressed with some of the school systems who very early in March started sending out readiness surveys to families, trying to figure out, okay, do you have a computer at home? Do you have enough bandwidth to handle this? Looking at the teachers and the teachers who would contact my son to say, okay, you didn't answer this question correctly. Let's get on Google Meet now, and let me teach you the right way to do it. And those are all going to be predictors for you to use to figure out, okay, my school is going to be ready, or uh-oh, they're not ready, and I need to be an advocate. I need to call that office, not just to complain, but to call and to share information, share resources, okay? Because we together need to make sure that our children are getting the right care. So I'm with you on this one, Eunice. I'm also very concerned, particularly for preschool and elementary.
In the area that you stay in, I know where I am on the north side, they gave us a laptop or iPad for the kids to use. while they were out of school. But then I was reading an article, and in some of the more underdeveloped areas, I should say, people didn't even have internet access. So there wasn't really a reason to give them computers. So in a situation like this, I know one school in the South Side was still having parents pick up like a homework packet, and then the kids would go home and do the packet and turn it back in. But when you think about just the convenience of everything, it's almost just more leaning towards the people who have the money to have, good internet service, who have a good computer or a good iPad to be able to teach their kids at home. And the ones who don't have that are lacking the necessity, the skills that they need to be able to be promoted to the next grade. And I spoke to the principal at my son's school, and they actually were told not to fail anybody. But promoting someone who is not ready, to me, is doing more harm than good, in my opinion. Because if you're not ready and there's no summer school bridge to get the kid ready for the next school year, then what do we do with the next school year? They're really behind.
Yep. And this is part of that impact I was talking about, right? The impact on education and where our children are going to be starting out in the next academic year. And this is true not just at the elementary school or the middle school, it's also true at the college level. It's also true in graduate medical education, which is where I am. And we're going to see that our children are starting out at that lower level, and we really need to be intentional. Again, it goes back to that advocacy, okay? Advocating for your child. And this disease has had a disproportionate impact on low-income families. It's had a disproportionate impact on minority families, because you're right, if you don't have a computer, then you can't even survive with the current strategies that are being used. And that's where, again, as a parent, we would have to insist, I need it on paper. I will pick up Johnny's homework at 12 and kind of wait for an answer, because you're not giving any option, or my child needs to be taught. But then that sounds easy. But how about the parent who doesn't have the transportation to even get to the school? Come on. So there's so many parts to this that we need to advocate at a state level. There is money available for education, and we need to not be afraid to advocate for our children to get what they need for their education. Major issues, but we need to stand up as parents for our children.
Absolutely.
Okay, viewers, let us use this opportunity to welcome the good-looking Dr. Ofori. Dr. Ofori, I don't know where you've been, but the women are holding down the house again.
Yeah, I know. They're doing a great job, Keep it up. Yeah.
Okay, viewers, I'm going to introduce Dr. Ofori. He's an assistant professor of the pharmaceutical sciences at the Chicago State College of Pharmacy. He is a professional pharmacist and a researcher in mental health and neuropsychiatry. Dr. Ofori, welcome. Thanks for joining us.
Thank you. Thank you for having me. Yes.
I don't know whether you've been listening to the conversation, but Dr. Sibo is updating us and letting us know how we can deal with our kids that most of us cannot stand during this pandemic. So if you have any questions for Dr. Sibo, please go ahead.
I feel like I'm on a hot seat tonight.
Absolutely. I would like to ask some few questions. So, when the pandemic started, we thought that kids were immune to this disease. So far, what is the trend looking like in terms of the impact that the COVID virus has on children?
Yeah, good question. So, we're finding that children are not immune from the disease. It's just that a bigger percentage of them have asymptomatic illness or mild disease. But unfortunately, once you catch this virus, you can still be a vector and spread it to others. But also, we have found that in a small subset of children, there is a rare complication of COVID-19, which is this multi-system inflammatory syndrome that does affect children. We've seen a number of cases here in the United States. Fortunately, the mortality rate from that is still relatively low, but it's something that parents and families need to be aware of. And also, we've talked about before that there are some subsets of children with sickle cell disease, children under the age of 1, who are at high risk. to get really sick if they were to catch this virus. The other thing that's a bit different too between adults and children, in COVID-19 in adults, we found that the virus is attacking the lungs primarily in adults, and we weren't seeing that same trend in children. So again, there's a lot that we're learning. This is a brand new virus, and it has a mind of its own. Some of you may recall in January, February, people said, oh, in the summer months, things would get better. We're in the summer, people. This virus has a mind of its own, and we're learning. So the key thing is safety, 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 social distancing, hand hygiene, and praying for a good vaccine to come out soon.
That's right.
Great.
Dr. Ofori, any more questions for her?
So, I mean, I want you to philosophically, if you were to get a vaccine today, what do you think will be the outlook in terms of how parents are going to be willing to have their children have the vaccine?
Yes, the majority of parents do go for vaccines, but there is that subset who are against vaccinations. And then let's also remember, this is a brand new vaccine, right? So I'm sure there's going to be a group of people who are going to wait for me to go get it. You know, I have one little bit of historical information about myself. I was one of the first people ever to get the chickenpox vaccine. I'm one of the few people my age who never got chickenpox. And I was first in line to get the vaccine when it came out. So I'm hoping there'll be more trailblazers like me who are willing to just get out there and get this vaccine so we can get enough herd immunity and keep the other people safe until they feel safe enough to go get this vaccine. But I do suspect that I think a lot of people are going to get it, but this is just me predicting. We'll just have to wait and see what happens.
Okay.
Dr. Sibyl, let me tell you what the African household is going to do. They're going to wait and find out if the vaccine gives somebody.
Exactly. Exactly. That's what I said. They're going to wait for me to get it first. And
if you make it, then we'll get it.
Well, the interesting thing is that I used to work at Confanochi in Ghana, and when the H1N1 pandemic, I mean, the vaccine came out, everybody was like, they're not going to get it. But guess what? When I went to work, the line was all the way to like Bantam, you know. So you can imagine, you know, people will say all kinds of stuff, but yeah.
Okay, viewers, don't go anywhere. We'll be right back. When we come back, we're going to ask Dr. Sibyl about the Sobolo question. Don't go anywhere. We'll be right back.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Hi, my name is Wachiame Kwame, the Rap Doctor. Coronavirus is a stubborn one, and because of this small virus, the whole world is on lockdown. But hey, hope is not lost. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctors. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they will give you an amazing discount. Mobile Doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile Doctors, the doctors in your home.
Hello, everyone, and welcome to the health segment on Trend Africa TV. I am Empress Mausi, your host. I am joined by Dr. Sibyl Mrs. Eunice Cromwell, and Dr. Ofori. I want to thank everyone joining us on this beautiful summer day. Dr. Sybil, there's been an argument, about Sobolo, and they're saying Sobolo is treating COVID-19. So, the sales of Sobolo has gone really high. So, I want to find out your take on Sobolo and the pediatric population.
Sobolo tastes so good. But it doesn't do a thing against COVID-19. I'm sorry, people. And with regards to
it's not an immune builder.
I'm so sorry, say that again.
They say it builds the immunity. Do you agree with that?
I will be honest. I have not studied Sobolo, so I cannot give you specific details, but I haven't seen any data to suggest that it actually does. Now, the other thing I need to add, though, for the pediatric population, beware of where you get your Sobolo from, because the sugar content. And we need to be aware of that. And when we think of children and growth and safety, particularly at a time when they're staying at home, we really do need to cut down on the sugary drinks. Water. So I'm not sure who's pro and who's against, but I'm sorry. I'm not.
Well, we have a Sobolo seller on watching us, and she's saying Sobolo is very good and it works. Okay. Thank you so much, Ms. Jennifer Saku. Dr. Ofori, over to you. Any updates on treatments of COVID in terms of vaccine research? What's going on?
Okay, so I do have some update, and since the last time that we met, there's been about 50 more clinical trials for vaccines. So far, we have close to about 10 of them that are like very close to stage 3. A lot of them are going to begin their third stage in July. There's a particular one from Moderna, which is one of the leaders in vaccine development, that will start on July 1st. So it's already started, to be precise. Our hope is that when they try these vaccines in a larger group of population, it will be proven to be effective, to be able to provide the immune response that we need, and also it should be safe. So these are the things that they will be measuring among the trial that is going to be happening. So give and take, we think that hopefully by early next year, we should have something in place. That is all things being equal. So the good news is that the trials that happen in stage 1 and 2 actually provided enough response, sometimes in some cases more than what somebody who has recovered from the disease. So that is a good sign. One thing I should mention is that this is the first time we're ever going to have any kind of RNA-based vaccine. It's never been tried before, but then we know that as technology advances, things can actually happen quicker than we used to, right? We used to wait for 10 years, 5 years to get a vaccine. Because of the advances in biotechnology, now you can actually have the vaccine produced in a very short time. So looking at the pressure that we are under, the economy is shut down, all the people are crying for treatment options. I think this is the best time to explore this kind of vaccine. What would I add? There are other treatment options that are like, we call them small molecules. Remdesivir is one of them that cuts down the treatment or the time that the patient stays in the hospital by 4 days. That is tremendous amount of time to save the patient of critically ill COVID patients as well. There's some kind of a high demand for this particular medication. As we speak now, I think United States has bought out every bit of it from Gilead Pharmaceuticals, which is the only licensed
Dr. Ofori, are you there? Okay. As we all know, we are live, so we might be experiencing technical glitches here and there. However, all is not lost. Dr. Ofori, are you there? Are you moving?
Yes. Okay.
Okay.
So where was I cut? I don't know.
You talked about the Gilead pharmaceutical company, the only one that was having it.
Right. So they have the patent to Remdesivir and they produce it, but looking at how things are going, I don't know if we find a treatment right now, and the way the demand is, how will my grandmother in the village get the treatment? That is one concern that I am worried about. Will it be a struggle for the rich and the poor? I wonder if that is going to happen as well.
Yeah.
So these are all things that I would like for us to keep in mind. Even if there's a vaccine, question is, will it be in the US for months before it gets to Africa? These are all questions. Also, I would like to inform our people that some people still think Africans are going to be used to try the vaccine. The vaccine trial is actually ongoing now, right? So when it comes out, that is when it's been proven and approved. So whatever you're receiving is not a trial. I mean, we do have a stage where we monitor it anyways after you give the vaccine or medication. It's called post-market surveillance. So that can happen, but then that's not part of the trial. That is just like taking Tylenol, and we still monitor Tylenol up to date, right? So that is part of the whole process. So in brief, that is what update that I have in terms of treatment options. But since we don't have any treatment, guess what? We still have to social distance. We still have to wear the mask and make sure that we observe all the personal hygiene we have to.
Thank
Dr.
you, Dr.
Ofori,
Ofori.
I saw on the news that they said they were doing a trial in South Africa, and people were writing articles that they were testing it on there. That's my first question. Is that not accurate? And secondly, do you think that it's going to be safer for people to just wait it out for the vaccine, or do you think more people are going to be leaning towards the antiviral medication in the event that it becomes more available in the United States?
Right. So I'll answer your question. Yes. So whenever there's any clinical trial, we try to incorporate as many people from different demographic as much as possible, because the Black person in the US is a little bit different from a Black person in Africa.
Right.
So you might want to include a whole different varieties of population in the clinical trials. So I won't be surprised that whatever is happening in South Africa, in most cases in Nigeria, they tend to do a lot of the trials in Nigeria as well. So that will broaden the population of the candidates for the trial. Also, I know that yes, you cannot take that out, that people are going to wait out and see what is going to happen to other people when they do take it. But my fear now is that looking at the rate at which we're going, if we wait too long, we might not need a vaccine because we're going to have a herd immunity. And I mean, that which will be a good thing and a bad thing, right? I mean, before we get that herd immunity, there's going to be a lot of casualties, right?
Yeah.
A lot of people are going to die as a result of that. But looking at 40,000 cases, especially in the US a day, that is a little concerning to me. So again, when the vaccine comes out eventually, my recommendation is that yes, of course you have to. I'll recommend that you do take it, especially if you're very susceptible to getting a very high risk or a very severe case of the infection, like aged population and things like that. One other thing that some people think is that, well, a lot of vaccines kind of depend on your immune system for response, right? And it's a general knowledge that a lot of people who are older tend to have kind of compromised immunity already. So part of the reason why we need to incorporate a wide variety of people in the trial is that we want to see that the people who are actually susceptible to like very severe form of the disease, would they be able to mount enough response to produce enough antibodies against the virus. So these are all things that we need to put into consideration.
Can I ask you a question
Dr.
or a
Sebo,
thought
you
about
can go ahead and ask
medication?
some questions. You can
Yeah,
ask.
so one of the things we did here in Maryland with regards to medication and even vent machines and availability was starting to think ahead about rationing. And we had a lot of ethics committees that were involved at the state level with the governor, kind of developing systems for what to do if there's not enough remdesivir to go around, if there's not enough of this and that. How are other states doing in this regard? We were fortunate in that we never got to that point as a state, but it's an important thing to consider as we move forward. And it's an important thing to consider in Ghana and in other places that will also have limited supply. How can we be proactive we've already seen with testing in the early days, if you were connected, you could get tested. If you weren't, you didn't. And the same could become true for medication. So any thoughts on how we prevent that in the future?
Yeah. So basically, in terms of when it comes to pharmaceuticals, this is one thing that I would say, and usually it becomes a little between ethics and the money, right? So, for instance, I mean, if you look at remdesivir, it's a very interesting molecule, small molecule. Anybody can produce it across the globe, right? But why is it that it's only one company that can produce it, right? So maybe as we move on forward in the future, we can make the laws in such a way that in cases like this, we can relax the rules, just like we did, and we gave chloroquine and hydrochloroquine a shot, right? We might be able to relax the rules so that everybody can actually produce it. India, China, everywhere, right? Unfortunately, this one is not like that. But if we do in the future have a vaccine or a drug that solves the world's problem, I think that we should make it in such a way that maybe an organization like WHO and the bigger organizations, African Union, all of that, can have a buy-in into whatever deal it is. The good news with vaccine is that right now, all the 176 trials, the agreement is that whoever comes out with it, we're all going to produce it. So that is a good thing about it. And a lot of the pharmaceutical companies, especially those who are in phase 3, already started producing enough for like millions of people, just as a backup, especially in the US. So that if it gets approved, you're not going to wait for the drug to, vaccines to be produced. So it's already produced in stock. Whilst I'm saying that, especially vaccines is like micrograms of the amount. So if you produce tons of it, it can actually serve a larger population of people. The only thing is that we're trying to be more proactive in this sense, and I think the US is taking that lead as well.
Interesting. So, Dr. Ofori, the trial population, do they usually try on pediatric ages too?
Yep.
They do.
So they usually, especially the stage 2, they try different age groups. Yeah. And
Right.
different races and things like that. Yeah. Before the response. So am I still on?
Yeah.
Okay.
Yes, you are back on.
All right. So you don't just give the highest dose, right? You kind of try and pick in between like a lower and a higher dose. So I think a few weeks ago, Pfizer also came out with their own vaccine, and which is also going into clinical trials. But when they did give the higher dose, they realized that almost about 20 or so percent of the people experience some kind of fever, right? So the question is, would you be able to differentiate between that fever and actually getting the virus? So it's a little tricky out there, right? So you do give it as a gradient. You go from lower dose to higher dose, and in most cases, you'll be able to tell out which age group and what is the effective dose for the different population.
Okay, thank you. Dr. Silva, were you going to say something?
Yes, I was just confirming what he was saying about the different stages. So in the first stage of trials, they tend to check for safety first. And so actually a lot of times children aren't included initially until we're sure about safety. And that affects many other conditions. And that's a whole other conversation because there's some trials that really need children to be in them so that we can have access to these medications. But yes, I completely agree with what he said.
Okay.
Dr. Ofori, can you also talk a little bit about the antibody testing and the antibody transplant? I was reading online that they were also looking into that for people who had recovered from it and developed a certain amount of antibodies. They were going to be using that, extracting it from those people and giving it to some of the people who are very, very, like deathly sick, to be able to help them. So is that more top of the line, or is the first line of defense that we're all waiting for is either the herd immunity and the vaccine?
Yes. So that was one of the earlier ways we're looking at it, was the plasma or convalescence plasma, right? So people that recover from the infection, you spin down their plasma and get antibodies and inject it to critically ill patients. So that is still something that some hospitals still do it. What I would say is that in terms of how much you can do, right? Like how many people can you get that with to becomes it's a limited supply, right? In terms of how many people can actually get that convalescent plasma. In terms of like how many the immune response and how to detect whether the patient has an antibody, we haven't been successful in the sense that that was one thing that we were hoping for, that we can pretty much do a test to see, hey, I have the antibodies, right? But so far, the false positives are too many to actually kind of pin down one particular test to see that, hey, I actually have immunity or some kind of antibodies for the virus. And it's a little challenging because you're trying to do some kind of a plot, we call them Western or Eastern plotting, to be able to detect a reactivity to the antibodies. And a lot of tests that we're doing, they are like fast track tests, right? So we want something that is quick, not time consuming. You don't have to spend too much time in the lab and things like that. And so far, from what I'm gathering, a lot of people are searching for that magic test that can determine if efficiently the antibodies level or whether you have it or not in your body. And we haven't had much luck with that.
Okay. Any more questions from anyone?
I have one more question. Has anybody on this panel, have you been tested for COVID-19? I'm asking this because I read an article the other day, and there's actually a lot of fear. People have seen other people being tested, and, they put that long thing in your nose, and, people are a little bit afraid to be tested. I had a meeting with our supervisors today, and they said, as we're transitioning to go back into the homes, one thing I'd like for all the providers to do is get a COVID-19 test. And I thought, oh my God, I was like, I'm so scared. So have any of you personally got the test? And if you have, will you share with our viewers whether it's really as scary as it looks, or is it just, is it fast? Is it quick? Or what do you think?
See, I just got the antibody test, so it was a blood draw. I did not have that long thing stuck in my nose, so I can't speak to it.
Okay.
Dr. Fori, have you gotten tested?
And I haven't so far. And I don't know anybody that tested for it, so I can't comment on that. Yeah.
Well, I haven't.
Oh yeah, I know one person. I know one person.
Okay. And
Donald
how did they tell you the feeling was?
You'll be fine. You can do it. It's just a swab in the back of your nose. It's uncomfortable for a few minutes.
Yeah.
But okay, I'm the pediatrician, so let me say, we test children and they do fine. So you'll be okay, boo-boo.
Wonderful.
So about 4 of my co-workers have tested positive, and they had to stay home for. Some people stayed home for 3 weeks. Some people stayed at home for months. And every time I was going to work, I'm back in school, so I really need days off to catch up on school. And every time I'm going to work, I'm like, I hope today I have a fever. I hope they're like,
and they'll send you back home.
Because I'm hoping I don't get infected, but I'm hoping maybe something else will cause a fever so that I can stay home and try and finish my darn homeworks, and they're advising us, or the job wouldn't let us test because they want us to test at the job. We have insurance through our job, and they don't think we should test unless you are exhibiting symptoms.
Symptoms, okay.
And because if we should all go test, I believe we might all turn out positive, and then nobody will be left to work in the hospital. So they're saying we shouldn't test unless we are exhibiting symptoms, and none of the symptoms are showing up for me, unfortunately. But I thank God I'm still here, and that's just it. My coworkers are all back to work now, and
oh, good.
Yes, they are. And then one described the pain as being the worst pain she's ever felt in her life.
Oh, wow. More than
Yes,
childbirth?
Wait, the pain of the test or the pain of COVID?
The pain of the test. She said that was one of the worst pains of her life. I was like, you know what? I'm definitely not going to test. I really don't have to. But then she doesn't have children, so I'm thinking, well, maybe that is the word. And pain is what the patient tells you. So,
Exactly.
I mean, everybody experiences pain differently.
Yeah.
So, I mean, I couldn't argue with her. Any more comments before we take a little break?
We have a lot of comments on the feed. So when you get back.
Okay, we'll read the comments when we get back. Then don't go anywhere, viewers. Stay tuned.
Charlie, this corona thing slow everything down, eh? When all this go end, make a call Dr. Amina say she get some information.
Hey, hello, Adam. I hear from you, Chao. How be you and your family?
We all be cool, oh. I hope say you be fine too. I dey call ask some questions about coronavirus.
Sure. What things you want know?
I hear say corona medicine dey wait them they hide them.
Me sef I hear, but it no be true. Plenty research they go on to find corona medicine, but this usually they take time. Researchers too they try some of the old medicines, and some they show good promise. We for hope say the hard work will pay off soon.
So what about medicines where people they call immune boosters? Then they fit prevent or cure corona? How about if I take plenty vitamin C and D?
As with all infections, your immune system they help fight corona. You go fit take some food supplements support your immune system. But if you dey chop balanced diet, you dey get enough nutrients. No research they so say taking plenty supplements will protect you from corona. The medicines them they call immune boosters too. Nothing they show say them go protect you.
And what about vaccines?
Yeah, vaccines they help, but that usually be to protect people them no yet get the disease. Plenty research they go on to find corona vaccine, but this usually they take time. People self-start talk say vaccines no good, but that no be true. It be sake of vaccines where some diseases like polio no they worry we again. You know what? The vaccine matter there. I will take my time explain them later.
Oh, okay. So how we go protect our body from corona?
The best way be say you for day house as much as possible. But if you for come out, you for wear mask then day at least 2 meters from other people. You for make sure say the mask they cover your mouth then nose all. You also for wash then sanitize your hands more times, then make you no touch your face. Take some bleach to sanitize your surfaces. If you feel say you get corona, you for quarantine yourself. You for rest plenty, chop well, then drink plenty fluids. But if you know they make better, then you for call the emergency numbers. If you get corona, it no they mean say you go die. More people they recover cry. Yeah. We all for follow these simple directions. So say we go protect we and other people from corona, and we no go overburden one of healthcare professionals than healthcare system.
Hey, Dr. Amina, that you shack rough.
Hey Adam, Sean that thing. Which madam then the kiddies give me?
Are you looking for photography service for your upcoming event? Is it a wedding, an engagement, or a special event? Look no further. Jojo Texan Images is here. Hire him today for great quality pictures, a quality service provided on the day, and a great personality. Jojo Texan Images is on social media. Follow him Instagram and Facebook at Jojo Texan Images or call him 312-450-5235 and book your appointments today. Jojo Texan Images. Simply excellent. Book him now.
It's here for Mechiamo God's afternoon. Yes, fellow Ghanaians, this is a public service announcement. No need to get excited. Your watch it stays the same. It's in the brown box now. Look at it right there in the green leaf. Bibiansa sign. Why? Mamunsru. Yep, rocks watch it. The watch in a jar, that's a specialist. Jar, you see, yep. We got a huge contract. This is for hotels and folks from out of town. Yep. Mamunsru. Environmentally friendly. Stays hot. I got a plastic. I gotta go. But this is not for you. I mean, you got a choice, but your choice, your watch it stays the same. It's Mamunsru. Rocks watchy. The original is there. In the demo. Yep. Powder fufu kremudi from so. Hey, who's that? Anyway, we open right now. It's lunchtime. The number to call is 0244-676742, 0244-797911. Rocks watch it to the world. Catch them and see a fan World Cup. Yes, yeah, do be a bit paiju.
Hello, everyone, and welcome to the health segment on Trend Africa TV. This is COVID-19, the way forward. I am being joined by Dr. Sibo, Dr. Ofori, and Mrs. Eunice Cromwell. Viewers, we are now, Mrs. Eunice, I have lost a lot of comments on my side. I don't know if you still have, you can see any of the comments.
Yeah, I can see a few, but only the people who I'm friends with, unfortunately. So, yeah. Okay, there is a question here by Sarah, and I think this is a really good question. I was going to ask Dr. Sybil. The question is that in the case of the flu, you're not given the vaccine if you report symptoms. Are we going to look forward to the same similar situation with COVID-19? I think that's important because a lot of parents really don't know, like, what makes the distinguishing marker where you take your child to get their vaccines, and sometimes they'll say, yes, I'm going to administer all, or I need your child to come back after they get over maybe sniffles, an abdominal, whatever. So what, as a pediatrician, when do you draw the line that, yes, I will administer vaccines today, or no, you need to make another appointment and come and get your vaccines?
Yeah, that's a good point. If someone has a high fever, we typically will not administer any vaccine, whether it's the flu vaccine or any of the other vaccines for that matter. But for low-grade fever, sometimes we actually will, because the risk of not getting the vaccine is higher. Now, flu vaccine, though, is unique. And especially flu vaccine in the African and African-American population, believe it or not, our vaccination rates are much lower. And people are much more resistant to getting the flu vaccine in general. So when a child is sick, certainly if you have egg allergy, okay, we're not going to give it if it's an egg-containing vaccine that you're giving in your office. So I suspect it might be a similar thing with COVID-19, but it's important to note that sickness overall is at a lower level, infection overall. So when kids aren't in school and things like that, so we're not seeing as many children who are sick or having febrile illnesses anyway. Okay, so I doubt that we're going to have a lot of people who aren't eligible just because of the reason of fever or sickness. Now, once they go back to school, it's going to be a whole different ballgame. So we'll have to see how that unfolds.
Okay, more comments that I see over here. I want to thank Helen Kweli, my own sister, for joining us. Alice Nyamiche, she's also a healthcare provider. Irajwa, thanks for joining us. Mawuse MFA, thanks for joining us. Jennifer Sako, our Sobolo brewer, is thanks for also joining us. Ibrahim Muhammad, thanks for joining us. Efa Ameyao, you also joined us. Susan Efuasaki. Susan Efuasaki looks like a new viewer, and she had some really good comments over there. However, one she said is tested, no swabs is just unexpected. You may flinch. Unfortunately, I didn't. Iradra is also asking, do we have the option to choose a testing preference, either with a blood draw or the nose swab?
The antibody testing is a blood test, and I think it also depends on the site that you're going to, and most importantly, why you're being tested. Because if you're being tested for acute illness, then you need the PCR. You need to know in the acute setting if you have acute illness. If you're just testing past exposures, then that's where the antibody is useful. So it depends on why you're being tested.
Okay, thank you, Dr. Sable. Alice Nyamiche says, I tested twice. It is not too bad. Helen Kweli is saying, hey, really? No for me. Alice Nyamiche says, LOL, it's uncomfortable. Will cause your eyes to tear up. I guess it depends on who is doing it.
Okay.
And then Susan Saki says, tested with 7 days to spare before new job in case I get ice 1 week free in old job before last day. They only call in 24 hours if positive. But Washington County, my chart system is superb. I got negative test notification by email, also available in the app. I got 72 hours for symptoms-free evaluation, which overlapped my off days. So I did get my 1 week indeed. Shoot, COVID-19 for essential workers is stressful.
Yeah.
Okay. So Helen Kelly is asking, so kids under 2 or under 6 don't need mask?
So children under 2 years of age are at risk as far as suffocation if they have a mask on. So that's one of the reasons why we do not recommend that children under 2 wear a face mask. It's not because they're less, they're immune to the infection. No, it's because the mask itself adds a risk that isn't worth it.
Okay.
So what do they do for that age population?
Oh, we
Your
do
children
not recommend masks at all. I mean, if you're, we do not recommend that they wear masks 24 hours a day like adults do when we're outside.
Okay.
So even when they start school, they don't need to wear masks in school?
See, I think once we go back to the school population, we're going to have to look at schools and specific guidelines. But for under age 2, again, it's that risk of suffocation from the mask. Some of these cloth masks also, hello, I can't breathe in them myself, let alone imagine a child, and if it's not the right size. So there are a lot of other risks there, and so that's the reason for that recommendation. There may be other recommendations when kids are going to school and maybe with specifics about the kinds of masks, but I have not seen that yet.
So for children under 2, I'm just curious, what precaution are they taking if we take them outside?
Still good old hand washing and social distancing. Still those measures, yeah.
Jennifer Saku says MOA's hibiscus drink. I don't know what MOA stands for.
Hey, these drinks are great for when you're quarantined, though. Let's tell the truth.
Right.
It tastes good.
Odelia Quatin, very informative presentation, excuse me. Thank you, Dr. Odelia Quatin, DNP here. Oh, hi, Dr. Quatin, how you doing? Do we know him or her?
We have a lot of people that joined in from the Association of Nurse Practitioners and then the Physicians and Surgeons group, which Dr. Civil is part of. So we have a lot of people who were very, excited to hear what we have to say. So big shout out to both organizations and thank you for providing us this brilliant pediatrician tonight to talk to us.
Oh my God, she rocks.
It's the Ghana Physicians and Surgeons Foundation, part of the DMV group, really wonderful group of physicians doing physicians and other providers. So it's not just a physician group, even though it's called the Physicians Foundation. So yeah, it's great to represent that organization.
Thank you so much. Iradra is saying something to, she's saying, and to add to that, I guess their immunity isn't as strong as older people. So it makes me question wearing mask. Jennifer Saku, MOA is my business name, she says. Kofite is watching. Kofite, thanks for joining us. Okay, Dr. Sibyl, I also realized you are a pastor. Could COVID-19 be a spiritual thing going on?
Of course. Things have all kinds of spiritual dimensions. So the problem I think we have is every time we say something spiritual, then we think it's not scientific. And I think that's where we struggle. We draw these lines where sometimes no line exists. And I think that's where the problem happens. If you're a spiritual person, then you're the kind that tends to believe that God has a hand in things that are going on in the world. And so from that dimension, yes, there's an element of a spiritual part to this. Am I saying that God calls us and God wants us to learn a big lesson? No, that's not what I'm saying. But I'm saying that there are things in the world beyond the natural, and we have to be able to appreciate both at the same time. They're not necessarily a dichotomy.
So, Dr. Ofori, when I asked that question, did it Did it? I mean, you got really excited all of a sudden. Do you want to add something? Dr. Ofori, are you there?
Oh yeah, I could barely hear the last few words, but
Okay,
yeah, I mean,
go ahead.
your question was whether it's spiritual, right?
No, I'm asking, you got really excited when I started asking that question. What do you want to add to it?
Oh yeah. So I have a different opinion about that. The only reason why I say that is the way our people back home interpret spiritualism and religion and all of that. Even though they said nobody should go to church, there were people who actually flaunted the laws and went to church with the hope that, if they went to church, probably God will save them from coronavirus or something like that. I just have a personal opinion that we should still do science and also do our religion.
Exactly.
Yeah, that is the only comment that I have to add to it. Yeah.
Exactly.
Okay. Dr. Sibyl, some viewers were actually arguing with me that cutting red onions and putting in the four corners of your room really sends away the evil spirit of COVID. Um, I mean, why are we drawing the line over here? I'm like, you guys sound so ridiculous. I can't even argue with you.
I have not seen any studies about great onions of any color and the impact that they have against a spirit or a virus. So, like Dr. Furry was saying, we need to look at both dimensions. You can't just caught up in it. And I hear your point, because as a people, again, back to my original point, we see one or the other. The minute we think something is spiritual, we stop taking medicine. Or because we're taking medicine, then we're not being spiritual. So I cannot comment about the onions. I know nothing about onions preventing COVID, whether in its spiritual or viral form. No, be wise. God has given you wisdom. God has given you a mind to understand. God has given us an ability to use natural substances to create health and healing. So we've got to use all of these dimensions and using the science that we have for our benefit and to stay healthy. In my church, when we first, I think it was back in March, we had one more gathering before all the churches were closed. And we instituted so many precautions. Anyone who was sick was not allowed to come to church. And in my church right now, we do temperature checks. And it's funny, I heard a pastor say that he heard people being upset. Why are you checking temperatures at church? And he said, well, Jesus checked temperature. You're either hot or cold. Hello. We need to apply wisdom in these things. God has given us brains. God has given us science. And God has given us spirituality. And we need to use all of them with wisdom to protect ourselves, to protect our children. There are pastors who have died. There are many people who have gotten COVID-19 at church. And you don't want that on you. Okay, that's not a burden that anyone needs to carry. So we need to be wise. We need to use the wisdom that we have, use the information that we have, and stay safe. And you can do all that and still pray.
Yes. Absolutely.
Helen Pelly has a question. So we need a mask only when we are around people. That means the air is not contaminated and I can go to the beach or the park for July 4th without mask as far as I stay away from people, right?
Yeah, see, the thing is with public places, you can only control yourself, but you can't control all the people around you. So you still need to be very wise. If someone walks past you and they sneeze and you're not wearing a mask, okay? Because the 6 feet, that goes away when someone sneezes or coughs or sings. The particles travel further. So you have to be very cognizant of that. And some of the beach scenes that we're seeing are crowded areas, and no one is paying attention necessarily to the social distancing. So again, you can't just take it as a blanket, I'll be fine, right? You still need to think about the whole setting and think about all the variables, the ones you can control and the ones you can't control. and you need to be safe in the midst of the things you can't control.
You can control. Okay. I would like to welcome Isaiah Ogo for joining us. Okay. I think that's all we have for the comments right now. Dr. Ofori, more than half of the United States is in red, meaning things have turned for the worse. Would you attribute this to what happened with what do they call it,
the protesting,
the protest with what happened with George Floyd, or would you say those
with George Floyd?
Yes, would you say those states opened too early, or were not just being as cautious as they may be? What is Illinois, the state of Illinois, doing great that we still have COVID under control?
So what I would say is that it is very interesting that all the states that really didn't observe a lot of the restrictions, but then also opened very early, are struggling right now. Texas, Florida, Arizona, all these other places, they're struggling. Those who went to the protest, surprisingly, a lot of them actually were wearing masks. We don't see any spike in the individuals who went to protest. Part of the reason is that transmission outside in the outdoors is kind of minimal compared to people in rallies and sitting close to each other as well. And besides, they listen to the signs. They wore their mask. A lot of them I saw on TV, and even in Chicago streets were wearing their mask. So it goes to tell us that if you ignore all the rules we're saying, the virus doesn't care wherever you are. And we thought that the heat was going to be the magic bullet in the summer. But Arizona, you can fry an egg when it's hot, right? and they're struggling. So that just went out of the window right there. So we should still listen to the signs. And in the words of Anthony Fauci, he says we are going in the wrong direction when it comes to what we are doing for COVID. Because 40,000 a day, that used to be like over a week.
Wow.
So imagine what will happen if we keep going the same way. We will record maybe 200,000 a day, and everybody's probably going to get exposed one way or the other. So we should be very careful. It's not the protest; it is because we are blatantly saying that we're not. Some people call themselves anti-mask or whatever they call it. People are protesting, and it's just not right. And
I think people are also tired.
Yeah, but the virus is not tired. That's one thing I can say.
That is very true.
Yeah.
People are tired, but that virus surely is
very true. Yeah. It's so true.
We can make all the, but it doesn't care, and it's actually killing a lot of people.
Yes, it is.
MPP. You guys are following Ghanaian politics or whatever. Somebody just died yesterday, right?
Yes.
And I'm wondering the reaction. I'm listening, So it's real, and it looks like some of the comments I hear back home, it's just sometimes a little interesting. That Black people are immune to the virus. We are so strong. We don't get sick. There's so many things that I hear, and it makes me a little worried. Because 2 months ago, I think Ghana had we are in less than double digits, right? We were in the single digits in terms of cash.
Yeah.
Now we're in triple digits.
Yeah, triple.
Right. So it's very how things are going. And again, it's a new virus. We don't know how it's going to pan out. So we should be in a protective mode, actually.
Yeah. And I think we also need to be advocates. I mean, and I think sometimes when the states soften the guidelines, then different organizations and companies also just kind of stop advocating for safety. But I think we all need to advocate. I went to the grocery store and they had taken down all the signs that kind of help people stay 6 feet apart. State said they didn't have to do it. I started tweeting and I started naming the company and saying, listen, you need to be a better advocate. Put the signs up. What does it cost you to leave the 6-foot signs in place? Why did you take them down and give a false sense of security where none exists?
Right.
We also need to be advocates for companies and places that our children are going to frequent to be safe. Now, you can't put a 6-foot sign out on the beach. So there's some spaces harder to control and to create safer spaces for them. But Dr. Fori, I love what you said. We're tired, but the virus isn't tired.
Absolutely.
Yes.
How do you all feel about the outside dining? I don't know how it is
Yeah.
in Maryland. Go ahead, Dr. Fori.
Yeah. So I was just gonna add that there's an interesting trend developing in different states in the U.S. where Chicago is actually going to start on Monday. If you fly in from another state, you have to quarantine for 14 days. So to all those who are listening who have plans to travel, these laws are changing very rapidly. So you could go on a vacation and stay more than the 3 days you planned because you have to quarantine because of the way things are spiking. So that is one thing that we should keep in mind, that we should stay put for now. I mean, and make sure that we follow all the rules in that regard. Yes.
Yeah, but Eunice, to answer your question with regards to dining, but I also want to take it to another part. We just talked about how tired we all are. And this infection is having a mental health impact as well that we can't ignore in terms of the stress and the anxiety, the pure worry that different people are experiencing. And this is also affecting the pediatric population as well. So I think we're in that stage of all of this where people are needing to go out. People are needing to have a sense of normalcy, whether it's safe or not. I personally have not gone out to eat yet, even though they're trying to socially distance and all that kind of stuff. I haven't been out yet, so I can't say what it looks like. But I know the better restaurants are trying to indeed make sure the tables are spaced and assuming that whoever you're dining with, that you're either in the same household, and so there are no risks involved in being close together. But you want to pay attention. It's better that it's outdoors than being in that closed space inside.
I think so too. Yeah.
You really do need to make sure that there's enough distance between you and other patrons.
And what about exercise? I'm sorry, I have one more question about exercise. I was reading an article and they were talking about how children need recess, right? When you have kids, if they don't have recess, it's a lot. I have a 13-year-old, so I know I'm struggling trying to make sure he gets outside. Now, he's 13, right? So putting a mask on him, he obviously understands why to put a mask on, but it's very hard to play basketball or run around with the mask on. Right, so he ends up having to take his mask off so he can be able to have playtime. I'm weighing the pros and the cons and knowing that if I keep him inside, they're eating more, right? My refrigerator is almost empty because I have 2 boys, so they're eating more. Almost, yeah. So they're definitely eating more. I want them to stay hydrated, but I still want to incorporate them having exercise during the day. So what do you recommend for parents to do?
Yeah. So as far as exercise, you should not wear a mask when you're exercising because you will run out of breath. So certainly if you're walking or running, you really don't need a mask, but you also need to socially distance. If someone is coming at you, you need to go to the other side of the street. Now for our children, though, that's a bit harder. So if he's outside shooting some hoops by himself, that's fine. He doesn't need a mask. But then what happens? Mom, I want to play with my friends. That's where it gets so hard. Yeah. I think if they need to do that, if you have the surgical masks, that's better because you can breathe a little bit better with the surgical masks. You really can't play basketball wearing a cloth mask.
No, you can't.
You
pass out.
Yeah. And now there are a few more surgical masks that are available on the market. So it's easier to get those. Now, the other part I wanted to do, I started thinking about this in preparation for this time in terms of children and different ways to address their needs. Because again, there's that mental health part.
Right.
Yes. You gotta let them do certain things just for their own peace of mind. And I divvied them up. So when you're talking with a preschool child, I call them the unaware. They don't understand what's going on. They don't understand the boundary. They'll cry, they'll get upset, but then they'll get over it. And then tomorrow they'll cry again. And it's fine. It's just a cycle. Just kind of get the daily cycle. They're the unaware. The elementary age, I call them the sometimes afraid, meaning they play the different roles. Sometimes they're scared and they don't want to go anywhere. And the next minute, I want to go to grandma's house, and they don't understand why they can't go. So they'll play the boundaries both ways. They'll misinterpret the boundary, or they'll interpret the boundary the way they need it to be, depending on the day and how they're feeling. Your middle schoolers are the hopeful. They will test the boundaries. They'll ask those questions. They'll ask the why. And you need to be honest with them, and you need to create a safe space for them to function in. Okay? And then they're the high schoolers. They're the invincible. They will break the boundary.
And see what happens.
Do what you're telling them to do. And you need to be aware of that and give them boundaries they can work with. And sometimes you need to cut a deal with them. And I've learned, Eunice, especially with 13-year-olds, bribery is good. Bribery.
Oh yeah, my best friend.
Dash of money just to bribe them, to get them to do what they want. The college students, though, they are very aware. They're very aware of COVID. They mistrust the system. And sometimes they mistrust our own intentions. So you've got to work with them. You've got to hear what their thoughts are. You've got to share your thoughts. You've got to negotiate. You've got to figure it out. Because at the end of the day, we want our children to be safe, but we also want them to have a safe space so that mentally they're at rest. It's been very difficult for our children. And so we have to create the balance there. I too was faced with the situation. We went through a very, very difficult situation in my household. And this was actually during the quarantine where no one was supposed to go anywhere. And I'm telling you, there was some tears being shed in this house. And a friend of one of my children came over, and I was like, you know what, come in. We need you right in this minute to help us get through the pain of everything else going on. So there's always that risk and benefit that we have to weigh as parents to help our children mentally get through what's going on. Now, going over to visit someone with COVID, okay, now I'm not talking about that, okay? The risk balance, we can't be unwise in the process. But yeah, sometimes we might find ourselves allowing certain things just for a level of peace of mind. But you still want to be able to use the hand hygiene, come on, the mask. You still need to be vigilant with certain things to decrease the risks.
Absolutely.
Dr. Sybil, I can really tell you an awesome pediatrician. Your calmness and you're putting smiles on my face and on our faces, and even your acting skills are so good. We might have to add acting to your credentials.
I've been trying to get a role, but no one will take me.
Oh my goodness! Well, this is a breakthrough for you, Trend Africa. Everybody watching, we've got to create a way for Dr. Sybil. Let us read some comments. Claudette Martinez Sapon, she says, Illinois have good leaders. The governor and the mayor is doing a phenomenal job. Yeah. Claudette says, thanks that our leaders didn't listen to Trump. And then Helen Pelly said, the president says it will soon disappear. He doesn't even wear mask. Leadership by example. Helen Pelly is saying, Dr. Sybil, you are amazing. So, Dr. Sybil, can people get in touch with you if they need your services? And could you please let us know how we can get in touch with you, if you wouldn't mind?
Easiest way, you can find me on Twitter at Sybil Pencil. I think that's the easiest way to find me. I love to connect on social media. So that's an easy way. On Facebook, I'm at Pastor Sybil. So you can actually follow me at Pastor Sybil. Those are the best and quick ways to get in touch with me. I'm a little bit of an activist on social media, so I do get on there and then cause some waves. But yes, that's a great way for us to connect.
But then we don't judge me when I add you as a friend on Facebook, because
don't worry. But I thought we were best friends.
I can get really controversial too sometimes. So I'm looking forward to adding you on Facebook.
Absolutely.
Okay, so right now we will take a little break, and when we come back, our professional panel will give us their ending remarks or closing remarks, and then we'll bring the show to an end. Viewers, don't touch that dial. Stay tuned. We'll be right back.
What it do, my people? It's your boy Kingsley Ego B, aka King the Preacher, aka the Peacemaker, aka the joy of the people is my peace of mind. You are now watching Trend Africa. Don't touch that dial. If you won't touch her. Come on there. Keep watching Trend Africa. We are here. Africa has come to stay. Don't touch that dial. One love. Keep watching. Ratata.
Yo, what's up, boy? This be your boy Agbeshide Nanya, aka our Gang Boss, aka Mr. Roro. Right now, I'm live on Trans Africa TV. Keep it locked, don't touch it. Our Gang Boss, 1 year second.
What's up? I go by the name of Mo Beats Banger, and you're watching Trend Africa TV. You dig?
Wagwan, people of the world, I go by the name Mafia, aka Young Bass. And I'm representing right now for Trend Africa TV with your one and only Royal Black Jesus. Watch Trend Africa TV this and every Wednesday live on Facebook. You see what I'm talking about? I'm a so. Bless up.
Charlie, this corona thing slow everything down, eh? When all this go end, make a call Dr. Amina say she get some information.
Hey, hello, Adam. I hear from you, Chao. How be you and your family?
We all be cool, oh. I hope say you be fine too. I dey call ask some questions about coronavirus.
Sure. What things you want know?
I hear say corona medicine dey wait them to hide them.
Me sef I hear, but it no be true. Plenty research they go on to find corona medicine, but this usually they take time. Researchers too they try some of the old medicines, and some they show good promise. We for hope say the hard work will pay off soon.
So what about medicines where people they call immune boosters? Then they fit prevent or cure corona? How about if I take plenty vitamin C and D?
As with all infections, your immune system they help fight corona. You go fit take some food supplements support your immune system. But if you dey chop balanced diet, you dey get enough nutrients. No research they so say taking plenty supplements will protect you from corona. The medicines them they call immune boosters too. Nothing they show say them go protect you.
And what about vaccines?
Yeah, vaccines they help, but that usually be to protect people them no yet get the disease. Plenty research they go on to find corona vaccine, but this usually they take time. People self-start talk say vaccines no good, but that no be true. It be sake of vaccines where some diseases like polio no they worry we again. You know what? The vaccine matter there. I go take my time explain them later.
Oh, okay. So how we go protect one body from corona?
The best way be say you for day house as much as possible. But if you for come out, you for wear mask then day at least 2 meters from other people. You for make sure say the mask they cover your mouth then nose all. You also for wash then sanitize your hands more times, then make you no touch your face. Take some bleach to sanitize your surfaces. If you feel say you get corona, you for quarantine yourself. You for rest plenty, chop well, then drink plenty fluids. But if you know they make better, then you for call the emergency numbers. If you get corona, it no they mean say you go die. More people they recover cry. Yeah. We all for follow these simple directions. So say we go protect we than other people from corona. And we no go overburden one of healthcare professionals than healthcare system.
Hey, Dr. Amina, that you shack rough.
Hey, Adam, Sean that thing. Which madam then the kiddies give me?
Hi, my name is Ochiame Kwame the Rap Doctor. Coronavirus is a stubborn one. And because of this small virus, the whole world is on lockdown. But hey, hope is not lost. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctors. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they'll give you an amazing discount. Mobile Doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile Doctors, the doctors in your home.
Hello, everyone, and thanks again for joining us on the health segment on Trend Africa TV. If you are joining us right now, welcome. However, I'm sorry to tell you it's the end of the show, and unfortunately, unfortunately, it's never too late, but all the information has already been put out there. So you can go back and watch our recorded version that we'll be uploading in a few minutes when the show ends, or you can also watch us on Trend Africa TV. Make sure you hit the bell when you subscribe on YouTube, and like us on Facebook, follow us on Instagram, and you have all these professional panels. You can also follow their social handles. We will try to be posting them so that you can follow them, and please share the feed. If I was naked shaking my butt right now, the numbers will get into 200, but because this is very informative program, the numbers are staying at 10 20, 10 20, but it's all right. There's still hope. Right now I would like to give Dr. I don't know if I should ask Dr. Ofori or Dr. Sibo. I was planning to take a road trip with the family just to drive interstate. I guess it's a bad idea. Are there barriers? Do anybody know if there are barriers in between states?
I don't think so, Dr. Ofori. Are there any barriers?
No, they're not. Yeah.
No barriers?
No. At this point,
Okay.
no. But if you're flying into the states, yeah, you might have to check in. Yes.
Oh, okay. And then maybe you have only 2 weeks of vacation, and then they're going to quarantine you for 2 weeks. It's like you just went to just get quarantined. Oh my goodness. So we better
You went to
stay
quarantine,
home
actually.
Dr. Sebo, I'm going to put you on the spot. I hope that next time when we need you, you're going to make yourself available, because I think we love you so much.
I love you too. I will try hard to be here. And thank you. I should have said this earlier. Thank you for accommodating me. I think we had tried to do this a few weeks ago and my schedule didn't allow it. So thank you for accommodating me. I'd be happy to join you when I can.
Thank you so much. What is your last remarks for our viewers, please?
Please stay safe. Please stay safe. Hand hygiene, social distancing. But since I'm a pediatrician, I've got to put a word in there for the children. Please pay attention to your children. Pay attention to what they're doing online. Pay attention to their safety. Even in these summer months, because of the decline that I talked about, please make sure that you're getting them engaged educationally. Just a few pages a day of reading, a few pages a day of some math activity or something like that will just keep them in a good place so that they're ready when school starts. Be an advocate. Know what's going on in your state. Know what the schools are planning to do for your children. So be an advocate so you can make sure that what your child needs is what's going to be available for them. And then, of course, keep yourself healthy too. And thanks again for having me on the show.
Thank you so much, Dr. Sibo. We will excuse Dr. Sibo right now. Thank you so much, Dr. Sibo. We'll talk to you later. Dr. Ofori, over to you.
All right, so I have some few things to say. The first one is when it comes to any kind of pandemic, behavior is very important, right? So we are saying we are tired and all of that, but the virus doesn't get tired. I heard something very alarming this afternoon about the fact that in Alabama, people are actually getting themselves infected just to win a contest. That is concerning, because if it becomes a copycat and people start doing that, we're in big trouble, right? Don't get sick and don't get me sick. That's the whole point that we're trying to preach here. So please wear your mask, wash your hands, try and stay 6 feet away from other people. Don't go to crowded areas as well. I just saw somebody make a comment about how many COVID-19 viruses are actually walking around, because there seems to be mutations, right? So what we realize is that a lot of the RNA viruses tend to mutate, but then they don't become very vicious. So that is one thing that we've observed, that it can spread easily, but then it will not make you sicker, like you mentioned, because the mutation actually dampens the effectiveness of the virus as we go on.
Yeah.
So that's all the last words that I'll leave out there. Thank you for having me.
Thank you, Dr. Ofori. Miss Eunice, what did you think about the show today and your last remarks?
I thought it was very, very wonderful. I just like to encourage everyone, if there's a specific topic that you're looking to get more information from, please let us know, because we are trying very hard to find people who specialize in different specialties so they can come and give us their insight and their information. That is what this whole program is about, the way forward, because we know that COVID-19 has disrupted our lives. So we need to figure out a way to live forward and live through it. So that is what I would say. And then I just would like to give just a little bit of information on the two organizations. And I would like for people who are either physicians or healthcare workers or nurse practitioners, feel free to join these very good organizations. First one is the AGAPNA, that's AGAPNA. It's a non-for-profit based in Virginia. It is open to nurse practitioners and nurse people who do anesthesia, excuse me. They have a lot of initiatives back home. They have a mission that's open to all Ghanaian nurse practitioners. They help things in Ghana, and a very, very wonderful organization. I'm actually a part of that organization, so I'd like to give a shout out to them. Also, as we talked about earlier, the Ghanaian Physicians and Surgeons Foundation, also on their WhatsApp chat, and that is where Dr. Sybil is a part of. They are also a 501c organization, non-for-profit, and they have a range of public health initiatives, advocacy, education programs, and again, they are helping Ghanaians in Ghana and the diaspora. So just two organizations that we can keep in mind. These are great resources. If you were to need something from any of these organizations, they help Ghana out a lot, and you could get a lot of valuable information about them. So I put the information in the feed below, and I just wish everyone a wonderful, healthy, safe evening. Thank you once again for joining.
So, Mrs. Eunice Cromwell, how does one join this organization?
So if they just go on their website, they have a small registration form, and you just
Okay.
fill it out, and then they'll add you to their WhatsApp platform.
Okay.
And it's been very, very beneficial. They follow up on a lot of things that are going on. People ask a lot of medical questions. I've seen some people even take pictures of certain things that maybe you don't know what it is in your own practice, or let's say your child had some type of rash and you were not sure. There's specialties from, all walks of life on those platforms. So very, very informative, and I've learned a lot since being on them.
Thank you, Miss Eunice. Have a good night. Thank you so much for bringing this. Oh, wait, I forgot to ask you, what is happening with Ghana National Council? Are they still, what's going on? Anything new?
The only thing new with Ghana National Council right now is that that Ghana Fest normally happens at the end of July, but because of the COVID-19, we had to postpone Ghana Fest just for the safety of the community. So what we decided to do was, in place of that, because you cannot really replace Ghana Fest, but in place of that, we're going to be having a virtual Ghana Fest, where we're just going to be having some concerts, maybe some cooking demonstrations, and some other things that will be accessible on our Facebook page, Instagram, and YouTube. So keep tuned to Ghana National Council. That should be happening on July 25th, and you'll be able to see some few things that you would have seen at Ghana Fest, but in the comfort of your own home and safe, of course.
Thank you so much, Mrs.
You're welcome.
We'll talk to you later. Thank you.
Absolutely. God bless you. Bye-bye.
Bless you too. Okay, viewers, I would like to use this opportunity to thank our sponsors. Our sponsors are Omama TV, Holiday Africa TV, Powerhouse Media and Restaurants, Akese Style Designs, Medus Designs, Odinuho Designs, and Ghana National Council. Thank you so much to our viewers. Viewers, this is an opportunity to come together to join our efforts with Trend Africa TV and the Ghana National Council in acting together to generate change that will save our lives and livelihoods devastated by COVID-19. So, viewers, it is our personal responsibility to take care of ourselves and our families. Let us continue to practice social distancing and continue to just follow the guidelines. If you have any questions, you can reach out to all these useful resources that we've had on this program, or you can just refer to the CDC website. Viewers, Thanks again for joining us. Good night, and I'll see you again in another 2 weeks. Bye.
Bang, bang, bang. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, a virus. A chewa, we go lost. Wash your hand daily with running water and don't stop. Keep away from non-family meetings and do something, bro. Pray for your enemy, pray for your family, pray for your country, yeah. Don't forget to keep clean with hand sanitizer. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, a virus. A chewa, we go lost. China, Japan, man down. Italy, UK, man down. United States locked down. What now? Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, a virus. A chewa, we go lost. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, a virus. A chewa, we go lost.
Are you looking for photography service for your upcoming event? Is it a wedding, an engagement, or a special event? Look no further. Jojo Texan Images is here. Hire him today for great quality pictures, a quality service provided on the day, and a great personality. Jojo Texan Images is on social media. Follow him Instagram and Facebook at Jojo Texan Images, or call him 312-450-5235 and book your appointments today. Jojo Texan Images. Simply excellent. Book him now.
It's here for me, Chiamo, God's afternoon. Yes, fellow Ghanaians, this is a public service announcement. No need to get excited. Your watch it stays the same. It's in the brown box now. Look at it right there in the green leaf. Beyonce sign. Why? Mamunsru. Yep, rocks watch it. The watch in a jar, that's a specialist. Jar, you see, yep. We got a huge contract. This is for hotels and folks from out of town. Yep. Mamunsru. Environmentally friendly. Stays hot. I got a plastic. I gotta go. But this is not for you. I mean, you got a choice, but your choice, your watch it stays the same. It's Mamunsru. Wati. Rocks watchy. The original is there. In the second demo. Yep. Powder for Fukramudi, so. Hey, who's that? Anyway, we open right now. It's lunchtime. The number to call is 0244-676742, 0244-797911. Rocks watch it to the world. Catch them and see a fan World Cup. Yes, yeah, do be a bit paiju.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.